Did you know that up to half of patients with inferior MIs develop sinus bradycardia? That's because the right coronary artery feeds the SA and the AV nodes. And so if that flow is cut off, then the conduction is going to slow down. And you add in a vagal overdrive from the infarct, and your patient can tank super fast. So let's look at this guy. We've got a 64-year-old man with substernal chest pain, got ST elevations in these inferior leads. While awaiting, he becomes pale and bradycardic. And so what are you going to give him? You're going to give him atropine, right? Don't reach for your fancy antiarrhythmics or your thrombolytics. You need to break the vagal tone. And so start IV atropine as your go-to. It'll block acetylcholine at the muscarinic receptors, and it lets the heart speed up. That buys you time for reperfusion therapy. So don't forget about atropine. Now, you might be thinking of some other answers here, so we'll scroll down so we can see these. Okay, so adenosine. Why don't we not give adenosine? That's an antiarrhythmic. It'll cause your AV node delay, so that could worsen it. How about your athoplase? Okay, so that's a fibrolytic agent. It's for ST elevations, and it's not for urgent PCI. So not going to be our immediate management here. So it's going to be used if our PCI is unavailable, and it's not going to be your first line. Amiodarone. Okay, so that's a class 3 antiarrhythmic. It's used for ventricular arrhythmias, and it causes negative chronotropy, not for the brady arrhythmias. Atropine, that's going to counteract your vagal tones. That's great. It's going to increase your heart rate, manage the bradycardia. It's going to be used for inferior wall MIs. Naloxone, you'd give that for an opioid antagonist. So if they're overdosed on opioids, then yeah, give them that. But here we're talking about bradycardia due to an inferior lead of the MI. So no, not going to be the best option. Phosphostigmine, that's an acetylcholinesterase inhibitor, so it's going to oppose the atropine's effects, so it'll actually worsen the bradycardia. Definitely not appropriate in this context. All right, so that's the gist here. Yeah, we'll see you guys in the next video. Like and subscribe.